My name is Cheryl Moose, and I am a nurse educator. My history in healthcare actually started with a bachelor's from North Carolina State University in medical technology. So I worked in the lab doing all the testing on everything for about 13 years, and during that time I decided to return back to nursing school, receiving my ADN from a local community college. Then I pursued a job in labor and delivery. I put out one application, and I knew that that's what I wanted to do. And thankfully I was blessed with that opportunity at Forsyth Medical Center in Winston-Salem. I worked in this high-paced, high-risk facility for 3.5 years, and I absolutely loved it and gained tons of experience and knowledge. But the commute was a little too much. It was about an hour one way for me to get to work. So I applied to a local hospital, and I was given a position there as a PRN job. After just a few short orientation days, I was offered full-time, and so I took that position. And so there I started out as just a staff nurse, and then I was asked to become one of the main charge nurses working Monday through Friday. So that's what I did, and I brought with me all of that great experience and knowledge that I gained at Forsyth Medical Center. And so I started pursuing my labor and delivery career at Catawba Valley Medical Center in Hickory, North Carolina. After working as the charge nurse for quite some time, the position became available for the PDC, which is the Professional Development Coordinator. And this is a fancy word, aka for nurse educator for the birthing center. And so I've been in this role now for almost 2 years, and I absolutely love it. I've been told several times throughout my nursing career when I would be with students and different things that when I would explain things, they would be like, oh, you need to be a teacher. So in essence, I have become that, and I get to do it in my favorite area. I know that the word passion is thrown around a lot. It seems to be that go-to word whenever you're in an interview or trying to express your interest in something, but labor and delivery is truly my absolute passion in nursing. So obviously that's the area that I've worked in for about 9 years now, almost 10, and that's the only nursing experience I have, and I can't see me doing anything else. The education project that I am interested in doing is one that there is a need for in our unit, and this involves obstetric triage. Triage can be a very tricky area, whether it is in the emergency department or in obstetrics. So one of the things that I would like to do is develop an educational program for all of our nurses that have 2 years or less experience in labor and delivery. It is our policy, you have to have 2 years experience to be able to perform obstetrical triage on the unit, but you are allowed to do that prior to 2 years experience, but the charge nurse has to sign off on your assessment, and you're to get with her and give her your overview before you call the provider, and she is to make sure that you've done everything that you need to do. We've had several new staff come into our unit, so there's definitely a need for this education. There have been some provider concerns with this new staff when they've been asked to triage a patient just because they don't have the experience and the critical thinking and prioritization that is needed to be able to triage obstetrically. So I'm hoping to put together a program that will go over a thorough obstetrical triage, how to prioritize those patients, the tests that may be needed to be performed, the things that you as the nurse need to accomplish prior to calling the provider to give them a good overview of your assessment of the patient. So that is what I plan to do, and I look very forward to finishing this program up and heading in that direction to getting my master's as a nurse educator. Thank you.